To Lucy to kick off the session. So Lucy, without further ado, please go ahead. The floor is yours.
Wow, thank you. And I noticed that you started the recording after you'd finished your own presentation, which was a very clever thing to do. Yeah, so my name is Lucy Purdy. I'm the workforce lead for the Frimley Health Diagnostic Programme. And when Gaurav said, would there be an opportunity to come and speak to you guys about opportunities to work within diagnostics, my first thought was to invite the imaging services team to come and speak to you about roles within imaging services. So they're not my team, but I work for them. And if I ask Jane and Bridget to introduce yourselves initially, and then we'll crack on. I've got some slides which I'll share and we'll crack on with the presentation. So yeah, Jane, do you want to go first?
Morning, everybody. My name's Jane Taylor and I'm the Radiology Support Manager for the Directorate.
And Bridget?
Hello, I'm Bridget Maynock. I'm the Radiology General Manager.
Thanks, Bridget. I think your microphone's on your head.
You are so right, Lucy. My microphone is on my head.
Do you want to just say your job title again?
Yeah, sorry, I'm Bridget Maynock. I'm the Radiology General Manager.
Thank you so much. Okay, great. I'm just going to share our presentation this morning. So it's going to be a bit of a whistle-stop tour of what we do in imaging services, and then the types of non-medical careers that we have. I won't be able to see hands or the chat box, so I think we'll probably just whiz through and then do the Q&A at the end, as has kind of been suggested by Gaurav anyway. Sorry, I think I just sorry, it's just a technical thing. When I move the slides then, could you just see my screen or could you still see the slides?
So I can see careers in imaging at the moment.
And if I do this so that I'm looking directly at you, can you still see those slides?
No, all I can see is where do I go for help?
Yeah, sorry, that's my desktop. I'm just going to reshare. Apologies.
That's all right. We're all learning together. We're all in this together, so don't worry.
I tell you what, though, I know what the first slides are. So as I find them again and share them correctly, I'm just going to invite Jane, Bridget, just to tell you a bit about the services that they deliver in imaging and where they deliver those services across Frimley. So would you be able to do that, please, Jane or Bridget?
I can do that for you, Lucy.
Thank you.
So radiology is based across about 9 sites between Frimley and Wexham. So we have the 2 main sites that are Wexham Park Hospital and Frimley Park Hospital. They deliver most of the diagnostic imaging, and they deliver plain X-ray, MRI, CT, ultrasound, non-obstetric ultrasound, fluoroscopy, intervention, dental, mammography, and we work in theatres as well. We also have a nuclear medicine department at Frimley, which involves the injections of radioisotopes, and then the patient sits against a camera and we can see the images that come up from within their body. We've got lots of little off-sites, so they stretch from Maidenhead to Farnham. So we've got King Edward's, we've got Aldershot Centre for Health, we've got Farnham, we've got Fleet, and we've got St Mark's, and they mainly do ultrasound and plain X-ray. Some of them do slightly more than others, but I won't go into all the detail on that. We've got the breast unit in the Parapet in Windsor, which is also part of King Edward's. And we've got Heatherwood, the new hospital at Ascot. So that's got plain imaging, MRI, CT, obstetric ultrasound, non-obstetric ultrasound, and lithotripsy for radiology. We also work in theatres. We take mobile X-ray machines up to theatres from the department and image patients whilst they're asleep having their operations.
Thank you very much, Bridget.
You're
So
welcome.
As you see, a very comprehensive set of services that are provided, which, as you can imagine, makes for lots of diverse and interesting careers for staff, and we have services across the whole patch of Frimley. So hopefully there's a conveniently sited local space for you guys if you're thinking of joining us. Sorry, with all that muddle over slides, I still haven't worked out how to share them so that I can look at you as well. So I apologise that you're looking at the side of my head. So a summary of non-medical careers in imaging. We have a vast number of radiographers who are registered healthcare professionals, as I'm sure you'll know. And radiographers are responsible for taking images of the insides of patients' bodies to diagnose injury or disease. It's a highly technical and highly skilled job, using expensive equipment, and as part of a really large multidisciplinary team. It's also a really caring profession, which I know you guys are obviously really familiar with, working with the public and the vaccination campaign. Radiographers are supported by radiology department assistants, and these are entry-level roles, and we have career pathways, including apprenticeship, in-work learning opportunities for radiology department assistants to study all the way up to degree level radiography qualifications, so that there's career pathway through the department. But radiology department assistants are hugely important for us in looking after patients and helping them to prepare for their procedures, providing lots of reassurance, helping them to navigate the department, and also they take on some learning and provision of technical skills such as cannulation as they progress through their careers. We've got a team of dedicated administrators and managers that lead and run the department. We absolutely couldn't do the work that we do without them. Mammographers are radiographers with additional training in breast imaging, and these guys are taking images to help detect breast diseases in both women and men. But there is a large screening program associated with breast screening, as you may well be aware. Sonography is another profession within the department, and sonographers are skilled at using ultrasound equipment. They may have qualified as radiographers initially, and may continue to be qualified registered radiographers, but they also come from other professional groups such as midwifery. So there are different ways into the sonography profession, and you'll very likely have heard of obstetric sonography, but there's also a large need for ultrasound diagnostics and therapeutics. Bridget and Jane, just correct me if I'm wrong, in non-obstetric area as well. And last but not least, medical physicists work with computers and complex imaging and equipment to make accurate measurements of radiation levels and test new systems. So that's really quite a highly technical role there. So I just whiz on, we've got 3 slides now, which just do a summary of career progression in different areas, and particularly there in the areas that we would be looking to seeing if you were interested in joining us so the first one for radiography. So the blue squares in the middle, not really squares, but arrows in the middle, these are the roles that we're planning within the department, and you can see that they flow from one to the other. And as you go from light blue to dark blue, you're essentially on an entry-level role, radiology department assistant, up to a qualified radiographer. The majority of our qualified radiographers at the moment will join us having studied at university for an undergraduate degree in radiography and imaging. But increasingly, we're able to offer some in-work learning opportunities for people to learn on apprenticeship schemes. We have staff who have recently joined degree level apprenticeship schemes, and we also have some more planned. And that is an area that may well grow in capacity over the coming years. And then the colourful boxes, purple, orange and yellow, that's really just to give a flavour of, once you've qualified as a radiographer, the types of special the types of work you might then go into. So purple is more sort of leadership and management, focusing either in a particular modality area or going on to more senior strategic leadership roles. There's sonography in the middle, which we touched on the last slide, and then advanced practice. And we've recently started increasingly to build opportunities for our radiographers to report on images as well as to be taking images themselves. So actually, Jane and Bridget, I was thinking we need to expand this even more, but we're really, these guys are really progressive in thinking about new opportunities for workforce, and people come and speak to them about things that they would like to do, and always interested to hear that. The green at the, we'll share these slides afterwards, so just to confirm, the green boxes at the top are apprenticeship or in-work learning programs, which are or may be available in the future depending on interest, and then the grey box, dark grey boxes below are the sort of out-of-work university study that people might do before they enter roles, so that's just for information there. I'm just conscious of time, so the next slide was Mammography Careers, but again we'll share the slides. Similar kind of progress. We have a progression. We have a Mammography Associate Apprenticeship, so people who join us as radiography department assistants or straight into Mammography Associate roles have opportunities for learning as well. And there are nationally some other apprenticeships planned for mammographers as well. And there's a lot of investment and interest in diagnostic workforce and developing new apprenticeships for diagnostic workforce, so we're really excited about that. The admin team, really important team. So it's a really simple structure for admin. We have lots of staff working on reception desks, hugely busy jobs, and hopefully really satisfying jobs. Our administrators are responsible predominantly for booking patients into slots, making sure that our equipment is always being used, and patients visiting the department have the information that they need to be able to access their appointment. We then have supervision and management opportunities. On the left there's examples of apprenticeships that the Trust supports, which would be suitable for people in those roles. And on the right, we've just put some examples of destinations that leavers might go on to, having worked in some or all of those roles within our department. So some people switch over into clinical pathways, joining potentially as radiology department assistants, but other people might go into other careers in back office, hopefully still within the NHS. That's what we would love, such as HR, financial, IT. There's project management opportunities in the Trust, and also very importantly, service management or commissioning. Lots of people, once they've got good grounding within administration in a particular department, will go on to do wider service management roles. And lastly, I've just mentioned the NHS Graduate Management Scheme, which people do go on to, having done some time with us, subject to meeting the entry criteria. So just going to pause for breath and just check if Bridget or Jane at that stage wanted to add anything.
Not for me.
Okay, thanks, Jane. And this is the final slide, just a summary of the roles which we would be really keen to hear from you on if you are interested in these roles, and we can send more information. So the registered professional radiographer, and then unregistered roles, which are radiology department assistant or senior radiology department assistant at band 2 or 3, depending on previous experience. Receptionist and administrator. My understanding is that you guys are all signed up to the Frimley Bank at the moment, and potentially sort of picking, and you can, when we open for Q&A, you can maybe tell us a bit about how you guys are working, but my understanding is you're able to work quite flexibly at the moment, and I guess we're suggesting as a next steps from this webinar is, if you're interested in any of these roles, I'll send out these slides along with job descriptions. If you email the relevant contact person there, then we'll send you a link to express your interest in those roles, and we would intend then to we'd intend to continue with a bank arrangement if that was your preference, and then as substantive vacancies are available, we can talk further about those. But I mean, it would be really good to hear from people about what you're looking for in terms of employment as well. So let's leave that open and have that chat in the Q&A. But that's the end of the formal presentation, and we're all three of us really happy to take questions.
Thank you so much for that, Lucy, and Jane and Bridget. I think that was really, I think it doesn't do it justice in terms of the amount of work that's there and just how complex the whole system is. And for you to break it down like that, and simplify it is a testament in its own right. I was making and jotting down notes as you were going along, because a lot of this is learning for me as well. And I almost try and put myself in the mind space of those who may be on the call. And some of those questions you've already just answered in terms of what are the practical next steps. If I'm working at, front of house, or I'm working as an administrator currently in the VAC site, then what are my practical next steps of actually applying for some of the roles, or just understanding a bit more about those roles that are available to me. And then linked to that, there was a question that I had around, I think, whether it was the apprenticeships, in terms of the duration of the apprenticeships and how long they take and what the level of commitment would be for them. And then it sort of said level 3 on some of the admin or senior team leader or team leader roles. What does that level 3 mean? Is that a band 3, or is that a different kind of scale somewhere?
That's a band 3.
Okay.
The Sorry, Lucy,
You
I was just
go.
going to answer the question about the apprenticeship. The apprenticeships go on for, I think it's 5 years, depending on what level you start at. So there's the commitment by the department to the roles, which is, I think, when you start at a band 2 level for that, it's 2 days a week. We give the training in the department. You go off to university for weeks, separate weeks throughout the academic year. But you can drop off the apprenticeship at various stages and be just an assistant practitioner who can undertake part of the role of a radiographer. So you can x-ray some things, but you can't do the specialized stuff like the mammography, the ultrasound, things like that.
Okay.
Yeah, so I was just got this slide back up to support what Bridget was saying. So that assistant practitioner role is the band 4 role in that career progression. As Bridget says, once you've got your diploma equivalent, which is if you were doing a standard university full-time degree, that would be after you've completed and passed year 2, so you haven't gone on to your 3rd year. For the apprenticeship, that's likely to take more than 2 years, and as Bridget says, there are points at which, including that point, you can step off and pause that, which makes it probably more accessible for people that are not going straight into it from school and able to give 3 years dedicated full time to study. I think your question about the level 2 and level 3 apprenticeship might have stemmed from this slide, Gaurav, did
That's
it?
right. Yeah. So
yeah, so I will send out with the slides, because it's going to test me now and I don't want to get it wrong, but there's a national standard for levels against apprenticeships, and it means that it basically equates to the entry criteria onto the apprenticeship and what you would leave with in terms of equivalence to other qualifications. So level 6 is equivalent to a degree, so I'm going to send that round because I don't want to get it wrong on here, especially as it's recorded. So
no, that's fine. And it's fine not to know all the answers, and then it's just me sort of being curious about some of the
yeah, it's a good question. I might be able to find the link and put it in the chat in a minute, to be honest.
And I guess for just having the experience of the workforce over the last 20 months and working with them, getting to understand what drives some of our staff, and the flexibility, the ability to work bank shifts has really been one of the key success factors of the vaccination program. And I think if we didn't have such flexibility, we would have really struggled to deliver. And so I think what you mentioned about some of the I think on the contacts page, or when you were on the contacts page, around the roles that they could jump into now. So without committing to an apprenticeship, what are the roles that they could sort of contact you for now and get the ball moving quicker on than something that's a bit of a longer term commitment that may be for a few, But I believe for the majority, they'd probably be looking for, right, okay, I'll contact Jane or Bridget or Lucy, and that means that then I'll have to present a CV or have the next conversation around whether it's an interview or whatever, and what the practical, sort of steps are for them to then secure that next role within the organization.
Lucy,
Yeah.
would you like me to answer that?
Yeah, go for it. Thanks, Bridget.
Okay. So anybody who doesn't have the qualifications to be a radiographer who wants to become in and do a bank role, the admin area is, I've forgotten what your question was now. The admin area, you can just step into those roles now. You can do bank in the admin area. The same with the RDA roles. It's the roles where you have to have your qualifications. Unless you have those qualifications, you can't just step in. I did see in the chat somebody put up a question about what an RDA does.
Yes, Steve's kindly asked that. So he's just asked, could you provide a bit more information on the assistant role, please? So yeah.
So the assistant role, there is a clinical role. They work alongside radiographers and radiologists who are the consultants who undertake some of the examinations, the more specialized examinations, and they assist the radiologists. They get patients in and out. They might do minor trolleys for procedures. They assist the radiographers by putting images through, getting patients in and out. It's like an HCA role. So they don't do things like temperatures and stuff like that on patients, but they assist the radiographers, they assist the radiologists, they get patients in and out, they cannulate patients, they observe patients in bed bays and areas like that where the patients may go off and there may not be a radiographer there available. So it's a general assisting the more specialized clinical roles.
Thank you. I think that's been
All
really
right.
useful and really helpful. I mean, Lucy, sorry, did you have anything to
Yeah,
add?
no, it's just one thing, just to clarify. What we've arranged is for some links to be set up for each of those 4 roles onto the trust's recruitment system. And I'm really aware that we want to avoid like putting people through onerous, like any kind of onerous pre-employment checks or anything like that you've actually already had.
Please do. Please.
We are talking, or I'm talking to the recruitment team about that. So we will try and minimize that where possible. It may be that somebody is interested in coming to work in an unregistered but clinical role, having done an admin role, and it may just be there's something additional that we would need to ask for in terms of some clearance, but we don't expect to ask for something that you've already provided, and I really hope that we're able to deliver on that. But what I was going to say is, in terms of the links, once we've sent out the slides and the job descriptions, if you then email the relevant contact and let them know what you're interested in, they will then send you the link, and that will invite you to express your interest in switching into that role on a bank basis. Obviously you've got the contacts there, so you can ask for other information as well that we can share with you. And then Bridget, do you want to say anything about the next steps after that, once people have expressed interest? Or it's actually, we didn't necessarily talk about that before, because I guess we didn't know what the level of interest would be.
I think if people are expressing interest, I would encourage them to come into the department, to have a chat and to have a look at the role. Maybe spend half an hour or so shadowing the role that they're interested in doing.
Perfect.
Because that's the best way to find out what the role is.
Lots of thumbs up there.
Yeah,
that clearly sounds very positive and something that I think most would welcome the opportunity to sort of take up. So popular.
Can I just go back to Steve's question? He asked for the entry requirements for an RDA. There are no entry requirements, just a general education is fine. There's no specialized qualifications that you need for that.
Goodness. Well, thank you so much for your time this morning and presenting and providing these opportunities. I believe that's going to be really useful for our workforce, and I think with those numbers of thumbs ups, it's clearly resonated with them and looks like a viable and feasible option for them to sort of pursue. So You're welcome to stay on the call. Because of my mishaps on emails, etc. I sent Alison and Emma on the road this morning to Salt Hill. So I'm so glad to see you've made it back to office or base, and you've joined us, and we'll sort of transition over into the Optilis pathways and the Optilis opportunities that we've got. But thank you so much, Lucy and team, for coming and presenting today. It's been really valuable. And like I say, you're welcome to stay. But now it's over to Alison and Emma. I start with a massive apology, but please do forgive me. I am smiling. It's sunny outside, so over to you.
Hi, good morning. I'm Alison. This is Emma. Actually, we had quite a nice road trip because it was an opportunity for us to catch up on what we're doing and where we are with the Optilis recruitment. So for those of you that don't know us, Optilis is owned by Wokingham Borough Council and Windsor and Maidenhead Council. So 50% owned by both those councils to deliver their adult social care. And that covers a wide spectrum of different services, from residential to home care, rehabilitation, independent living, respite services for those two councils. So quite a wide spectrum of opportunities. Currently, we're running on about 45, 50 vacancies. There are more services coming under the Optilis banner that are being 2P'd across as well, which will also give different types of scope for job opportunities. The main roles that we're looking for is what we call a support worker. And this could be supporting learning disabilities within their own homes. And also another big area for us is what we call STS&R, which is short-term care assessment and assistance. A lot of the time from individuals coming home from hospital that need a short care plan to get them back to the best independence possible to be living at home. And those two teams are huge teams within the organisation. For most of the support workers, there doesn't need to be any experience within this area. It's the want and the belief to want to do it, and I think that comes from inside rather than any experience that you may have. But the interaction with people that you have been doing with the vaccinations will give you a great benefit and an asset to join us, which is why we're really interested to talk to you today. So I'm going to pass over to Emma, who's going to quickly talk through the types of roles that are in STS&R. They're mainly Windsor and Maidenhead based, and that is for the Windsor and Maidenhead Council. So Emma will give you a quick rundown on what those services look like.
Hello. So I think the most urgent role is for a team that are growing or looking to grow, if it's possible to do so. We're looking at the moment. I kind of looking at about 4 rehabilitation care workers. Rehabilitation care workers, I would say, is very similar to domiciliary care workers. But I myself was a domiciliary care worker, where you go in and you build long-term relationships. This is a little bit different because you're working with the social workers and the OTs and supporting a care plan, which is usually for about 6 weeks. And it's really to, whether they've had a hip replacement or an illness, it doesn't matter. It's getting that individual, helping to get that individual back up to looking after themselves independently. And really providing that kind of support and guidance as well in order for them to do that. In terms of again, you don't need to have experience. I think it's the want to do care work. I'm very open and honest. There will be some kind of element of personal care. And some people rather not do that. That's absolutely fine, but then it's a case of it's going to be a lot of different kind of needs that our clients have when they come out of hospital. So it's a very varied role. You're supported by other team members as well. In terms of what do you need, you do need the want to do it. We offer full training, absolute full training, really supportive team based in Town Hall. I've just placed 2 care coordinators that are really going to help those individual rehabilitation assistants go out and support them. In terms of what do they need, at the moment, they will need their own car to do this particular role. We pay 45p mileage. The one good thing about it is that, you know, it's all about the care, you know, and I as a domiciliary care worker before, you know, you're very much on a time frame because you've got to get to one person to the next person to the next. I think what's very good about this is that, you know, you stay with the client as long as they need you. You know, so you're not having to rush off to the next person. So, you know, you're giving that dedicated support to those individuals. So that's one area for STS&R at the moment that we're really, really looking for people. And then the others, as Alison mentioned, was for the independent living support. We've got Brill House in Maidenhead. And we're looking for a number of staff, whether it's waking nights, mornings, days, even just weekends, you know, and that's the same with the STS&R. You know, if there's anyone there that out there that, you know, can only work mornings, can only do, you know, weekend work. A lot of people doing their MVQ in health and social care, you know, sometimes come out and do it, you know, just for the weekend. We could be flexible. It's all about getting the right people at the end of the day.
Brilliant. So again, for Wokingham, there's the rehabilitation services, there's the respite care, residential home and independent living. So when we talk about independent living, there's multiple sites where 2 or 3 individuals will be living independently in a house in the community, and our support workers are there to support them to lead their best independent life possible the way that they want to lead it, because they're making the choices, but they're doing it in a safe environment. So you're not there to do their housework. You're not there to do their washing and their cooking. You're enabling them to be able to do it for themselves, and pushing them to make them, you know, enjoy that independence. A lot of the people that we support are coming from family homes, so first time away from parents. So there is that transition time as well. And what we do find sometimes is the parents are a little bit overbearing, and, you know, this person won't do that, they'll never do that, they can't do that, because they have been cotton-wooled a little bit by their parents. When they get into an independent setting, you'll see them thrive and just blossom into someone that actually can do these opportunities, and it's a really rewarding role. And as Emma said, we can look at bank staff, we can look at part-time contracts, we can look at full-time contracts. Within the rotas, there's scope for everybody to be involved. We do have a full training package that does happen, and that consists of in-house training in our head office, but also some e-learning as well, and then shadowing. So the shadowing continues until the new employee is comfortable with the role. So there's no time scale on that. And you'll be, the person is observed that they can do the role to their best ability and to what we're looking for as the level of standard that we're looking for. And that continues until that person is ready to do it on their own. There's no lone working. Within the locations, there is always at least 2 support workers at any time. So if someone perhaps is looking for just nights, again, we can accommodate that. As Emma said, and I've said, it's about the want to do it, not the experience. As far as process goes, you can email Emma or myself with a CV, or we can send you an application form. We try to make it as streamlined as possible. Nobody wants to be filling out endless paperwork for no reason. As long as we've got some detail that we can talk to you about, the next step then would be for us to put you together with one of the registered managers of the services that you're interested in. Interviewed, we will do the DBS, we will do all the paperwork for you, and get you on board as quickly as possible. Does that help?
Thank you so much, guys. That was very helpful, and I think I was just again I was making some notes as you were talking, and I think there were a few things which were really apparent from what you were saying, and I think the key messages that I've taken from what you've said is the first thing is that you know the want and the desire to do the role. You know, that's I think a really critical element of this is that you really need to have your heart and mind in the type of work that you're trying to recruit to here. Is the word flexibility kept coming up. You know, it's really flexible, you know, in terms of what you can provide, in terms of options for the staff going forward. And, you know, whether it's bank work, nights, days, mornings, etc. So there's clearly a lot of flexibility. I think it's also just the number or the sheer number of opportunities that are available that you've got within the system. And I think that's sort of almost that's a picture of the whole scene, you know, across the country. It's just how much we're struggling to get people into these roles, and I think we're almost, you know, trying to put an olive branch here out and say that, come on, guys, give it a go. And I really like the idea of, you know, part of the process is to come and see. And I know that we've spoken about this in the past, Alison, but you know, you just saw Lucy sort of extend that offer out as well for someone to come and almost try the role or come and, you know, at least experience it with what they may be doing. You know, that opportunity exists here as well. So someone can jump into the shoes or be mirroring or be part of a team that's going out there to really get to grips with what it's like to be part of that team, the support that's there for them.
Yeah. It's a
And
very hard role. It's, you know, you're looking after people, and you've got to have that makeup inside you that you can do it and you want to do it. We're not an agency and we're not a private provider. So the fundings that we get from the two councils are delivered straight into the quality of care that we deliver. We don't make a profit on caring for someone. Whatever's not spent at the end of the year from the funding goes back to the council. So morally, it's a very transparent organisation to work for, and you know, everybody that works within the organisation is very passionate. We've got some real talented individuals that are within the organisation, and it's the first one in the country to work with two councils like this, yeah, it's just it's great, rewarding, transparent. Your opinion matters. It's a lovely place to work, supported.
and the whole training, upskilling, the development, and then just the sort of moving through in terms of career progression and the opportunities. I mean, I know we're talking entry level and we're talking about very much, you know, to the audience on the call today and who will be watching this as well around, you know, the front of house staff. We've got the admin staff that we've got, and maybe some clinical staff as well may see this if that's something that they're willing to move into. But it'll be really interesting to hear, right, okay, once they've gone through that initial phone call or passing the CV over to you, you know, and signed up, you know, what kind of careers could they have?
Yeah, we've had, so within our training team at the moment, we've got ex-support workers that have moved through into the training team that now deliver the moving and handling, the medication training, that type of thing. We've had support workers that have come through and moved through into our HR teams. So, you know, they've got first-hand experience of the challenges that the support workers have had. And, you know, someone with that experience or in the HR team, they recognise and can relate very confidently and professionally about the challenges. We encourage growing from within. A lot of our support workers move through to team leaders. We then will support individuals to do their registered managers qualifications as well. And as the business grows and the more locations that are coming on board, you know, there's a huge arena of opportunities for people.
Social work,
Yeah,
occupational
we've had
therapy.
social workers, you know, train as social workers and gain their qualifications that way as well. So it's always it's open and honest, as in you're not just a support worker, although that is the most important role in my eyes. But there are the opportunities to progress. All the opportunities are very transparent. And there is a real feeling of, if someone wants to apply for something, it's an open and honest communication and process internally. And there's no holding back anybody from applying to another sector of Optalis. So it's a nice place.
Thank you. Now, I'm conscious I'm doing a lot of the talking and I'm asking all of the questions. But is anyone else, wanting to ask any questions, wanting any more information, or is everyone stunned into silence? Or is it just Friday and it's too hot? One or the other. But look, I found that really useful, and I think, for me, the accessibility is always key with these roles. Some of our staff have had quite a torrid time just receiving or securing a contract because of the labor intensive work required to just fill in documentation and one thing after the next. And so if there's anything to learn by the process through the VAX program, it's to make the onboarding side of things as easy as possible, the sort of gaining the contractual side of things as easy as possible, so the accessibility into the service. And then, when everyone gets on board, they're fine. But it's the biggest gripe has been, how do we move from not having a position of employment to being employed by your organization? So
I would say the only thing that we but the only thing that stops us taking someone tomorrow is we are controlled by the CQC, and it is the DBS. We can get the references, we can do all the paperwork, and we can do that quickly at interview stage. We encourage people to bring as much as they can to the interview stage. It's the DBS that controls us. Although the last few weeks we've seen DBSs coming back in 24, 48 hours, and these are people that perhaps you would have thought would have taken longer, whether they're an overseas worker or, for instance, that even police checks from overseas have been coming back in 48 hours. It's been incredible. What I would say is, if someone wants to look at it from a bank possibility, we will be coming into what we call our winter pressures and our winter staffing very soon. We want to get everything in place by the end of September. This time of year, we do need even more support because of the winter months and the challenges that brings. So if somebody did want to do it through the winter period and then relook at it January, February time, just to see them through that process until they decide what they want to do long term, we're absolutely open for that as well.
Thank you. Any other questions or anything else that you could sort of leave in terms of details? I've seen a question in the
I saw that.
just about email addresses, but is there anything that, I know that you prepared some documentation and you've probably got that in physical format, but have you got that electronically that we could share out with everybody? And then we'll still get the opportunity to do the face-to-face stuff, and that's from the 22nd. I know you're eager beavers, but
well, we know the way now.
Yes, at least you know the way to Salt Hill now, which is great. So yeah, it's just something that we can share with everyone beforehand, and that could probably facilitate the conversations when you're on site. But yeah, anything that you can share would be greatly received, and we can send that out to everybody, not just those on the call today.
Yeah, and if anybody just wants a quite a casual chat to work out if it is going to be for them, then we're here. We're always open to have a conversation. Will it work against the commitments that I've got? Is it something that I want to do? Then just talk to us about where you are, the concerns you may have, and we're happy to talk to everybody that wants to contact us.
And are you happy for us to put your email addresses in the chat? Okay, so I'm just doing that as we speak. Multitasking is not a good idea, but I will try. Okay, I guess that sort of concludes the session. Just wanted to say thank you to everyone who's made the effort to attend, obviously to our lovely presenters who have some been around the mill today, But yes, it's been a very valuable session. I've learned a lot, and I'm sure those on the call have learned a lot as well. I guess the only thing I want to sort of lead this session with is next week is our final drop-in session, and we are having a CV writing kind of workshop. So for anyone who is wanting to get some tips and tricks on how to make their CV more appealing, bring it up to date, or just dust off that document that you once had in the cupboard, just please come along. And we've got some real expertise in the room who will talk through how to develop and how to make you stand out amongst the crowd. So thank you so much.
Thank you very much.
Thank you.
Take care now, guys. Bye-bye.
Bye. Bye-bye.